Guys, before I say anything in this video, please watch this video.
So you can see what's in the bowl. These are fibroids, fibroid nodules of a woman who is 41 years and has been having these fibroids for over 15 years. He's been moving from one hospital to the other with medications to squash, destroy, shrink the fibroids. The fibroids keep growing. He's been having severe anemia, has been transfused like 2 units of blood for almost every month. He bleeds so heavily that he has to be transfused. And he's still hoping that the medications will shrink the fibroids. See how huge the fibroids are. Look, how is this so hard? How is this one going to melt? Going to melt from where? Going to shrink from where? It's as hard as stone. Remember, if there are drugs that will actually melt it, then it can even melt your intestines, can melt your internal organs. So don't listen to them. They are just going to, you spend more money, and then at the end of the day, you won't get.
And you can see how hard that thing is, like a rock. Many women have been deceived that this thing is just like blood and can easily melt away. But these things can actually calcify and be in form of a stone. So there are so many false claims that some products will be able to shrink this fibroids. So these false claims and misleading information, they are unproven. So how can you prove this, that the product they are giving to you is effective? Many products has claimed to shrink fibroid naturally with no scientific backing. So these claims, if you now ask them, how do they know that this thing actually work? This, they rely on testimonies from other people. Maybe the person that product shrink their fibroid away is the person that has their own inside their uterus, and it is of a very small size, and this product goes there to melt it away. But you that have fibroids that are hanging on your uterus that needs to be cut away by surgical procedure, and yours is large enough that it causes you extreme symptoms, you go and follow those people and be taking those herbal teas, herbal medicines and other concoctions. Please avoid this misleading information. They don't even talk about the potential risk of consequences of taking all this herbal medicine. For that, they will give you 1 gallon of something you don't know what they actually mixed inside, or herbal teas that they brought different types of leaves you don't know about and mixed to you for you to drink. So these medicines can have unknown side effects which can interact with other medications you are taking. It can even cause liver damage, kidney failure, and the rest of them. You have, at the end of the day, you find out that you have also wasted your resources. Spending money on ineffective treatments can be financially draining without providing any health benefits. So always work with your gynecologist in cases like this, because the gynecologists are trained to solve that problem. So there's nothing that can melt that thing that is hard as rock and of that size. When these herbal remedies or natural remedies come in play is when you have gone to the hospital and they tell you that the fibroid is very small and is not causing you any symptoms. So that's when you go about taking anti-inflammatory foods, exercising, and doing things that can help to bring your estrogen hormone down, because it's the estrogen, when it is imbalance with the progesterone hormone in your cycle, it causes a lot of things. It causes ovarian cyst, it causes fibroids. So it is the hormone imbalance that causes all those things. So when this fibroid is still at a very minimum size, that is when those remedies can come to play. But when they have told you that this fibroid is large and it is in different part of your uterus and you are trying to conceive, please, my dear, do it. do it in a very good hospital and in the hands of a gynecologist that has been proven to have done this procedure many times and is successful. Don't just leave this fibroid to overgrow and cause more harm, because once you are leaving it to overgrow and cause more, it causes infertility, it causes pelvic adhesions and the rest of them. So, and it can cause you to fall for anemia because you lose so much blood when menstruating. Some even menstruate up to 2 weeks, 3 weeks, and they are giving medicine to stop the bleeding. So you see, don't suffer in silence. Go to the hospital and meet a well-known gynecologist to do that procedure on you so that you'll be free. And if the fibroid is the main cause of your infertility, then you will get pregnant. I've seen many women that after their fibroid surgery, they were able to get pregnant, because this fibroid can be detrimental to the fetus as it fights nutrient and blood supply. Once you get pregnant with your baby, it fights nutrients with your baby, it fights blood supply with your baby. So you don't want that, and some eventually miscarry the pregnancy. So you see, the best thing you should do is to remove that fibroid and be free. If it is the cause of your childlessness, it will be solved. But so what causes at some point, most women complain that after fibroid surgery, they were not able to get pregnant again. What might be the cause? Once after surgery and you were not able to take in within the first 3 months, it is advisable to go for HSG test that can check the patency of your fallopian tube, because at some point these fibroids go to the extent of blocking the fallopian tubes and causing infertility. So that's why you need to work with your gynecologist, not running from helter skelter and eventually damaging or causing damage to yourself, or even spending more and unnecessary resources. So this video has added value to you, I know. So do the right thing by consulting with your healthcare provider when you have this condition. That is your gynecologist.